Hi, my name is Rachel Savage, and today I'm going to take a few moments to explain to you about Edward de Bono's 6 Thinking Hats method, which is taught in Nurse 320, titled Introduction to Nursing Leadership in the University of Mount Olive RN to BSN program. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive. I have 2 goals and objectives for this brief lecture, and that's to understand Edward de Bono's 6 Thinking Hats method and to learn how to use it. Edward de Bono's 6 Thinking Hats method is sometimes referred to as parallel thinking. It identifies 6 different points of view as a way to deepen and widen our critical thinking skills one hat at a time. De Bono explained this in a way of looking at a house, and if a group of people are around a house looking at the 4 different sides, they each have a different point of view, and they're all discussing their own point of view. Whereas if everyone moves together around the house, they can discuss the same point of view because they're all looking at the same side. One area in nursing where I have found there to be the most disagreements or varying opinions is usually around discharge planning. One straightforward example that I typically deal with on a weekly and daily basis is discharge planning with home infusion needs. And I will use the 6 Thinking Hats method to play out this scenario. So first and foremost, we have the white thinking hat. That hat comes bearing the facts. In this situation, it will be the physician or a mid-level provider who comes in saying the patient is ready for discharge. They need 6 weeks of IV antibiotics at home. Well, that's great. So what do we do now? How do we make that happen? Well, once the news trickles down to the patient may be wearing a red hat. And the red hat is carrying a lot of feelings and a lot of emotions. The red hat may be asking, how can I do this? Are we sure that this is the best plan? And they're worried and concerned. Next to them at the bedside is someone wearing the black hat. And the black hat carries with it skepticism. The black hat may say in this situation, we're not nurses. We've never done this before. We're really scared. Are you sure this is the best idea? Luckily for all of these hats, we have a green hat. And the green hat comes in bearing some creativity. The green hat may say in this situation, okay, is this really the best plan for the patient? Once they've confirmed with the provider that yes, this has to be the plan, this is what the patient needs, then they let their creative juices flow and they say, well, okay, let's work with the patient. Let's get them what they need. How can we go about that? Once the green hat does their job and starts working on the creative process and finding solutions, the yellow hat walks in. If it's a good day and it's me working, then hopefully I am wearing my big yellow hat and brimming with possibilities and optimism and hope for the patient. And we reassure them that you will be fine. We will make sure that you are taught, sir, how to use your IV antibiotics. We will make sure your caregiver is taught, that everyone is comfortable and competent before they leave the hospital. And we'll also provide extra support for them at home, such as a 24-hour number to reach a nurse or a pharmacist should they need to. Now, this is a lot of hats. It's a lot of things to try to coordinate. So behind all of the hats is one blue hat. And the blue hat, it helps manage all of the other hats. So the blue hat may work behind the scenes. In the hospital setting, a lot of times it's the case manager or social worker who is coordinating all of the other hats together. And they're the ones that get the ball rolling. They're the ones that in this situation may have sent the referral to a home IV infusion company. They've worked with the patient to help support them and get them through any roadblocks that they may encounter, such as costs, transportation home, and things of that matter. Now, This was a brief lecture to inform you of Edward de Bono's 6 Thinking Hats method. It was supported by current research articles found in the International Journal of Nursing Practice, the National Teaching and Learning Forum, and the Journal of Educational Science and Technology. So thank you all so much for your time and attention. If you would, please complete the short survey. It's provided through the Nursing Student Center, and email it to my professor, Dr. Joy Kiefer, at jkiefer@umo.edu within the next 3 days. Thank you.